Good morning. I'm Assemblymember Bonta, proudly representing the beautiful people of Oakland, Alameda, and Emeryville, and thankful to be here with you today as we talk about AB 1975. Food is life, food is substance, food is medicine. I'm proud to be able to bring forward this bill in cooperation with the California Legislative Black Caucus as a legislative priority. Thank you all to those who are able to join us today for the launch of our Food as Medicine initiative and to talk about AB 1975, which I will be presenting today in Assembly Health Committee this afternoon. As Assembly Health Chair, I know that too many Californians, particularly Californians of color, are living with largely preventable chronic illnesses and conditions. Adequate food and nutrition are a fundamental part of preventing and treating chronic conditions and can significantly improve a patient's quality of life. We have all heard the saying, an apple a day keeps the doctor away. But the truth is, we need our healthcare system to include food into our medical treatment plans so that the docs are kept away, the ER docs are kept away, the specialty docs are kept away, especially for our most vulnerable residents, such as Medi-Cal recipients. Medically supportive food and nutrition services should be a covered benefit for all Medi-Cal recipients. AB 1975 will ensure it is. To put the potential of this bill's impact into context, consider this. 37% of Medi-Cal recipients suffer from hypertension. Studies show that medically supportive food and nutrition interventions can reduce blood pressure, which for a patient with a cardiovascular disease can reduce the risk of health by 15% and reduce the risk of stroke and heart failure by 39%. So yes, healthcare system, give our hearts an apple, not angioplasty. Black women and birthing people have over 1.5 times more preterm births than their white counterparts. Pregnant people who receive a medically supportive food intervention have seen a 37% reduction in rates of preterm birth. So yes, healthcare system, give our pregnant bellies smoothies for smooth deliveries. This effort is also important because it continues the legacy of former Alameda County Supervisor and Assembly Health Chair Wilma Chan, who created a similar program in Alameda County. Alameda County's programs, Recipe for Health, have been helping residents to be healthier and is a recipe for health. The program rests on prescriptions for healthy food, behavioral changes, as more exercise and training for doctors and staff, use food rather than drugs for treating, preventing, and reversing certain chronic diseases. I'm incredibly proud to partner with SPUR and the Food as Medicine Collaborative to take this concept, her concept, statewide with AB 1975. Now you will hear from my colleague, Chair Lori Wilson, and Assembly Member of the Transportation Committee, Chair of the Transportation Committee, but most importantly, Chair of the California Legislative Black Caucus.
Good morning. As was noted, I am Assemblymember Wilson, Chair of the California Legislative Black Caucus, also representing the 11th District, Assembly District, and co-author of AB 1975. The California Legislative Black Caucus has included this bill in our 2024 Reparations Task Force package because of the attention it brings to the lack of access to nutritious and affordable food in low-income, brown, indigenous, and black communities. As a legislative body, we need to work together to disrupt hunger and nutrition related to illness. As a body, we need to talk about the intersection of food and health. Take food deserts as an example. Nearly 1 million Californians, 45% of whom are low income, live without access to nearby supermarkets or large grocery stores in communities known as food deserts. Lack of access to healthy, fresh, nutritious foods has a long-term health impact. Disproportionate access to affordable, healthy foods contributes to poor nutrition and perpetuates health disparities, leading to higher rates of obesity and other chronic ailments. This is why this bill is so important. Food can prevent. Food can heal. Food is medicine. As we know, the Medi-Cal program is crucial to providing health care services to low-income individuals. This bill aims to improve the program by emphasizing the role of nutrition in overall health and well-being. One of the key aspects of AB 1975 is to focus on addressing health disparities among Medi-Cal beneficiaries with chronic conditions such as congestive heart failure, cancer, diabetes, chronic obstructive pulmonary disease, and renal disease. By providing medically focused intervention services, we can better support individuals with these health conditions and improve health outcomes in our communities. Ensuring every Medi-Cal recipient is eligible to receive a medically supportive food and nutrition prescription from his or her health provider is our first step. In conclusion, AB 1975 represents a significant step forward in enhancing Medi-Cal by integrating medically supportive food and nutrition interventions into the program. Now, by prioritizing nutrition as a key component of healthcare, we can make meaningful strides in improving the health and well-being of Medi-Cal beneficiaries across the California. This is the goal of the California Legislative Black Caucus, to not only restore Black California, but by doing so, restoring all of California. Thank you again to my colleague for introducing this important piece of legislation.
We will now hear from our colleagues in the field. I'm happy to introduce Katie Ettman, Food and Agricultural Policy Manager at SPUR.
Good morning. As was said, my name is Katie Ettman, and I'm the Food and Agriculture Senior Policy Manager at SPUR, a nonprofit think tank in the Bay Area, and I am incredibly honored to be standing by Assemblymember Bonta and representatives of the Legislative Black Caucus to bring you AB 1975. AB 1975, Medically Supported Food and Nutrition, builds on the work of California's transformative work through a Medicaid waiver, CalAIM. And within that Medicaid waiver right now, we are testing and piloting ways to address the social determinants of health, like food insecurity and housing insecurity. And I'm honored to say that through this pilot phase and the first 21 months of implementation, medically supported food and nutrition has been the #1 most utilized service, reaching more than 29,000 Californians who now have the opportunity to access the food they need to live healthy and fulfilling lives. By working on and passing AB 1975, we can build on the work of CalAIM and make sure that we are not just piloting these necessary services, but making sure that they are available in perpetuity, so that no matter what healthcare provider or what managed care plan you're receiving services at, you have access to these important and life-saving services. I'm also excited to say that this bill covers a spectrum of food as medicine interventions. There are many different ways that people need to be able to access food. If you are incredibly sick, maybe you've just left the hospital and you can't cook for yourself, it makes sense to get a medically tailored meal, a meal that is tailored to your specific needs delivered to your home. But let's say instead you're struggling with gestational diabetes. You are likely still cooking for yourself and grocery shopping, and so a better fit might be a produce prescription, where you actually get a voucher or a card to go out to your local grocery store, farmer's market, or corner store to buy your own free fruits and vegetables. In both of those instances, medically supportive food and nutrition can improve your health, but we're making sure that we are matching the acuity, the intensity of the condition that you're dealing with to the intensity of the intervention, so that we are meeting patients where they are at in order to see the best long-term outcomes. All of this also means that we can see improved health outcomes, but also healthcare cost savings. We're incredibly fortunate that studies show us that by subsidizing healthy food, we can actually save healthcare costs in the long term. So this is not only a win for patients, but it's a win for California at large. So I'm incredibly honored to get to co-sponsor this legislation with the Food as Medicine Collaborative, and to Assemblymember Mia Bonta for being such a strong champion. Thank you.
And we will now hear from, we will hear from Dr. Chen, and Dr. Stephen Chen is the Chief Medical Officer of Alameda County Recipe for Health. I will say that I got to visit with Dr. Chen as a part of the City of Alameda Youth Collaborative, and Dr. Chen at the time was launching the Recipe for Health program in the County of Alameda, and we know that there have been incredible results from this, so very happy to have him here today.
Thanks so much, Chairperson Bonta, for this opportunity. My name is Stephen Chen, and I am the Chief Medical Officer for Alameda County's Recipe for Health program. It's our Food as Medicine program. I'm a family physician with 24 years of experience in the safety net systems. I am called upon by federal partners often to brief folks on food as medicine. I briefed the Secretary of Health and Human Services, the USDA Deputy Undersecretary at the USDA, and congressional leaders and their staff. So first, why food as medicine? First, the bad news. The bad news is that our American people are sick. 6 in 10 of our adults have a chronic condition. Chronic conditions like prediabetes, diabetes, hypertension, to name a few. A primary driver of chronic conditions is an unhealthy diet. And this unhealthy diet is now surpassing tobacco use in being the #1 cause of death in our country, leading to about 500,000 people dying a year just from that alone. Another important driver of chronic health conditions is food insecurity. And when our patients are food insecure, we know that their risk of developing chronic conditions can increase twofold, such as in the case of diabetes. Now, the good news is this. Food as medicine programs across the state are springing up and addressing this situation. Recipe for Health is one of them. And how it works in Alameda County is that Recipe for Health equips our healthcare providers to prescribe produce and health coaching to patients with food insecurity and/or chronic conditions. The produce prescribed is grown locally by BIPOC farmers who are using regenerative and organic farming practices, which then minimize the toxic pesticide residue on the foods and increase the vitamin and antioxidant content of the produce grown. The following health outcomes have been reported by our evaluation team at Stanford and UCSF. Number one, 1/3 of our pre-diabetics and diabetics show a clinically meaningful reduction in their blood sugar. Number two, 2/3 of our patients improve their cholesterol indicators so that the risk of heart disease is decreased. Number three, food insecurity is improving by 25%. And number four, emergency room visits are reduced by 15%. Now, from an economic perspective, for every $1 spent on sourcing our food locally from BIPOC farmers, $1.9 or $1.90 is generated for the local economy. In Alameda County, Recipe for Health has scaled to 10 health centers, and we've touched over 6,000 unique patients. 83% of them identify as BIPOC. So to achieve all of this, Recipe for Health was one of the first food as medicine programs to utilize CalAIM to have Medi-Cal pay for these food as medicine services. And so with this, we are really pleased to share our experiences and looking forward to this becoming a law for our state and moving this forward. Thanks so much.
Thank you, Dr. Chen. We'll now hear from Elizabeth Duran, the patient participant in Recipe for Health.
My name is Elizabeth Duran. I live in the East Bay, and I'm here to share about my experience with open source wellness and Recipe for Health. The pandemic was a very scary and unstable time in my life. Losing my job of 30 years forced me into an early retirement and into an isolation that completely changed my life, including losing my health insurance. A knee injury led to surgery, which made it even harder to be active. I gained weight. I took medication for high blood pressure, which got even higher because I wasn't sleeping well from all the stress. On my last visit to my doctor of 10 years, I was prescribed pills for anxiety. This was a first for me. I never took the pills, I just dealt with it. Soon after, I found myself on Medi-Cal and at a clinic, Tiburcio Vasquez House Center. I was terrified. Much to my surprise, I was welcomed with warm, open arms. I went in to get established with a provider at the clinic, and my new doctor suggested a program which would include free organic vegetables once a week, plus health and wellness coaching called Recipe for Health. He described that I would learn about nutrition and be supported by a friendly community, so I jumped at the chance. Within a few days, I got a phone call from the Recipe for Health team to enroll me in the program. What I initially envisioned as a weight loss program turned out to be much more than I ever imagined. Not only did I receive beautiful organic greens and vegetables, I learned of their nutritional value and how to incorporate them into a healthy diet in the most affordable way. I am cooking and eating much better today. I look for new recipes online that include collard greens and Swiss chard, things that used to be unfamiliar. I learned how to incorporate different types of physical activity into my daily life. I never thought I could get a good workout via Zoom, but I learned that I could. And mindfulness has become a new tool I now use to bring calm and peace during stressful times. In all my years of private health insurance, no one ever asked me if I wanted to learn about healthy eating or offered resources. Open source wellness has made me feel wanted and cared for again when I was turned away elsewhere. My worry has become less, my sleep more. My blood pressure is at a healthy level. I am feeling happy again and not from a pill. I became so inspired I didn't want to leave. I didn't want time to end here. So here I stand as a peer leader of open source wellness, continuing to benefit and wanting to inspire others who may be in a dim place as I was. Californians across the state, like me, need these critical programs to support our health. I urge your aye vote for AB 1975, which will ensure programs like Recipe for Health becoming permanent Medi-Cal benefits. Thank you for allowing me to share my experience. It has been an honor.
Thank you so much, Ms. Duran. I had to chuckle there because my mom has pushed a Swiss chard on me more than any person I've ever known, and I think she just needed to go visit with you. So thank you again, and to my colleagues and to our beautiful community and this collaborative, to be able to stress the importance of being able to put food at the center of our sustenance and our well-being by providing this very necessary Medi-Cal benefit for every Medi-Cal recipient. It doesn't need to be a pilot or a program. We know, and the science backs, and our experience tells us that this works better than pills, works better than surgeries, works better than all of the ways in which we are not showing up for our communities. Give us an apple. Give us care. Give it to every Medi-Cal recipient. Thank you so much. Assemblymember Bonta, happy to answer any questions, but want to just make sure that we are on the right track for a healthier California. Thank you. Thank you.